It is my great pleasure to introduce to you my colleagues in Campus Life. I'm going to go around the group and then each one of them will tell you a little bit about themselves, what they do here, and what their office manages. And then we'll get into the Q&A. So first, I'd like to start off with Bryant Ford. Dr. Bryant Ford is the Director of Psychological Services. We use a lot of acronyms here at Brown, so I'm going to say that stands, when you hear the word CAPS, that's Psychological Services, and that's Dr. Ford. So Bryant, will you introduce yourself?
Hello, everyone. My name is Bryant Ford. I am the Director of CAPS. I use he, him pronouns, and I'm the Director of Counseling and Psychological Services on campus. CAPS is one of 5 areas in the health and wellness area that's under the leadership of Dr. Vanessa Brito. And my colleague, Tanya Purdy, is going to come on and talk about her area, but I thought I would mention the 5 just so that everyone's on the same page. We have Counseling and Psychological Services, we have Be Well Health Promotion, we have Health Service, Student Accessibility Services, and then we have Brown EMS. And so those 5 areas comprise health and wellness. At CAPS, we offer a number of services for students who are managing or interested in exploring options to manage their mental health concerns. The areas that we offer that might be helpful are individual psychotherapy. We also offer urgent care services. We have psychiatry evaluation as well as management. We have outreach, and then we also work with students in terms of workshops. We do offer groups, but the groups in terms of treatment groups often do not get a significant number of participants. And so we've had to be flexible in terms of the numbers and the kinds of groups we offer each semester. What is also really enjoyable about working with my colleagues in CAPS is that we also have 3 embedded therapists. So we have one provider who actually works with graduate students. We have another provider that works with medical school students. And then finally, one clinician specializes in working with athletics. I want to be very careful by saying, just because we have an embedded therapist in those areas doesn't necessarily mean that those providers only see students in that area. All of us at CAPS are generalists, and so anyone who comes into our offices, we see. I think what's also important to remember is our urgent care coverage. If ever a student is in crisis, they can always be seen 24/7. During the business hours, we actually have a provider that is on site, and a student does not have to call to schedule an appointment to be seen for urgent care. That student can walk in and declare that it is an emergency, and then they will be seen by the urgent care clinician at that time. Please know that if we get more than one student who shows up for urgent care, we treat it like the ED. So what we do is we assess for acuity. And depending on what is most risk, we will see that person or address that situation first. After that, we then will address the students who come in later, if the urgent care clinician is with a student. We do not turn any student away from urgent care if they're coming in. So just know that if a student comes in, we will meet with them. And in case anyone is wondering, when we meet with them, we assess the situation and we always end the session with a plan. So you can be assured that your student has a plan for follow-up after an urgent care session. After hours and on weekends, we have something called CAPS on Demand. And that is a platform where a student can call our number, and those numbers are on the back of their ID cards. Once they call the number and follow the prompts, they will be then connected to a service that will triage the situation and also come up with a plan for them. And what's important for you to know is that when issues arise in the evenings and on the weekends, CAPS clinicians come in the following day or that following Monday, and we address the situation by reaching out to the student for follow-up. And then the last thing that I think I'd want to talk about briefly is timely care. And I think that's an important resource that is important for you to know as well as for your students. To ensure that we do not have a delay in care, we partnered with an organization called Timely Care. And the goal of Timely Care is to provide fast and efficient service for all of our college students. So students can register on the platform. Once they register, they can then get connected to a provider, and usually that happens within a few days. They get 12 free sessions per academic year. So the academic year runs from August to August. And they, depending on when they do this, they can actually go from one academic year to the next. And I think the last piece to the timely care that I think is really important is that there's also a library of digital self-care content where students can actually go on and take a look at certain videos that might address some kind of health or mental health concerns. And I'm going to end with this by saying the reason I am excited about this particular panel is just as with the digital self-care content, I think when we think about mental health services, there are a number of resources that Brown University has to help students manage mental health concerns. Not everyone needs a clinical appointment or a therapy appointment. And that's why I'm so honored to have my colleagues here. Even though Tanya is part of the clinical part, she also works with folks who may be doing more of the psychoeducational piece. And then my colleagues in student support services who are non-clinical, they provide significant amounts of support for our students. And they also work to support them in ways and in tandem sometimes with CAPS when we're working with students here at Brown. So at that point, I'm going to end and I'll turn it back over to Mikkel.
Thank you, Bryant. Next up is Christopher Lujan, and he is in Student Support Services, as Dr. Ford just mentioned. We refer to that as SSS, and he is the interim co-director and associate dean. Christopher?
Hi, everyone. Good morning or good afternoon, depending on where you're at right now. My name is Christopher Lujan. I use the pronouns he, him, his. I'm one of the interim directors and associate deans for the Student Support Service Office. I'll introduce my colleague in a sec. Just a quick overview of Student Support Services. The Student Support Service staff is available to assist students who may be facing a wide range of difficulties or challenges while they're at Brown. That can consist of personal, health, family, etc. That may interfere with their academics or social engagements on campus. Student Support Services deans help facilitate interventions and help students connect to the right resources on campus. As you may know, Brown is a very big place and there's a lot of support for our students here. And sometimes students just need a liaison, a connection, a support to help them navigate through those resources. Some of those resources might include some of our wonderful colleagues on this call, CAPS, Be Well. Deans are also available to consult with peers who are worried about a friend's well-being. And the office partners very closely with our 24-hour administrator on-call system to provide follow-up support for students in crisis, distress, or following an emergency. I'll now turn it over to my colleague, Amanda, to introduce herself.
Thank you so much, Christopher. And again, good morning, good afternoon, good evening. My name is Amanda Dickinson Byrne. You can call me Amanda. And as Christopher shared, I am one of the co-interim directors of Student Support Services, SSS. As Mikkel has said, so many acronyms to keep track of. Hopefully, as parents and families, you have a running list, but if you need that reminder, please feel free to let us know. We're linking things in the chat. The work of Student Support Services, as Christopher shared, is really working with students who are navigating something particularly complicated or complex at the university, right? And that's interrupting their ability to persist and thrive. Christopher gave some examples. Maybe it's academics, maybe it's their personal life. And folks can meet with us one-on-one, again, to get connected to resources, but also to co-create what kind of resources and what sort of plan makes sense for them and how comfortable they feel with connecting with some of those resources, right? So we want to invite your students in to the conversation. It is not always singularly Student Support Services saying you must or you have to connect with some of my amazing colleagues on this call, right? We want to make sure that we test with the student what makes sense for you in this moment, but also how comfortable do you feel to start to connect with some of those resources? And we can be accountability partners in that, but we're also testing with the student, again, where they feel most comfortable to plug into resources. Sometimes at Brown, as Christopher mentioned, there's a bevy of resources and there's so many different offices and it can be hard to keep track, of what makes sense for me to go to first based on what I'm navigating. And we're a good place for students to land so we can figure that out with them, not for them, right? That's something that I would want to make sure that I highlight. Two other things, not exhaustive, that sit with our office that may be of interest to you or you may not be aware of as parents, family members, and those that support students perhaps emotionally, but also financially through their time here at Brown. We work with students when they feel ready to take a medical leave of absence. It is our office that administers that process. And so if you're ever wondering, my student needs to take some time away from the university and it's related to a mental health or a physical health concern and the intersections of the way in which taking time away would make sense, we're the office where students meet with and then process a medical leave of absence. We're also the office if a student unfortunately loses someone who's close to them, right? A family member or a close friend. We issue what's called bereavement notes, and that's a notification that goes out to family, to professors if they have a loss, so that professors know that they are experiencing something particularly difficult, and they may be absent during that time, right? To travel for services or to travel to be with those in community to either celebrate the loss or grieve with others. And so those are two examples that I would highlight. The medical leave of absence process and bereavement are two things also that sit with our office, and students can meet with us if they have any questions about either one of those processes.
My name is Tanya Purdy. I am the director of Be Well Health Promotion. I use she, her pronouns. Bryant talked a little bit about the health and wellness model that we have at Brown. We are 5 sibling departments, and Be Well is one of those 5. At Be Well, we use an empowerment model that focuses on both prevention and response. And our work is both evidence and community informed. That's really important to us and really important in terms of the efficacy of the interventions that we provide, that we are doing our research, looking to the literature and best practices. And we're also taking our time to get to know our community, understand what the needs are, and understand what the most impactful interventions might be for our students. So we provide interventions on both the individual and on the community level. So that sounds kind of jargony. So what that actually looks like is support groups for students who have chronic illnesses, peer education programs around sexual health, overdose prevention and naloxone distribution, restorative yoga workshops, online education tools for stress reduction, and 24-hour sexual assault response line. That is not exhaustive. That is just a couple of the things that we do that focuses our work. So we have a large diversity of opportunities for students to engage in well-being practices wherever they're at on the spectrum. And I say that because we meet students where they're at. They may be struggling with specific symptoms of emotional, behavioral, mental health, or they maybe are thriving and they want to engage with us to maintain their health or their well-being. So we're able to meet students on that full spectrum, provide resources and interventions so that they can maintain or really engage and get to where they want to be in terms of their well-being journey.
Thank you, Tanya. Thank you to the entire panel. We have a lot of questions, so let's get started. And I think this first set of questions is going to be some of the nuts and bolts, some of the questions that may be basic for some who students have already used the services, but are also, I think, really helpful for a number of folks. So I'm going to start with you, Bryant, for the first set of questions. And I'm going to group together this one. Can students, do they have access to a therapist on the Brown campus? Is there a cost for this? And is a referral required?
Great questions. Yes, students have access to mental health providers, and I don't say psychologists because we have folks trained at both the master's and the doctoral level. So we have licensed independent clinical social workers, licensed mental health counselors, as well as psychologists. Students have access to them, but I think what's important to remember is as students access our services, they first come through a first appointment, which is called a treatment planning session. And we always want to make sure we're doing some table setting with students and parents so they have an understanding of what's happening. A treatment planning session does not necessarily mean that the student would be seen at CAPS. It means that we're going to talk with them about what's going on and how do we help them get connected to them and match them to the right intervention. Sometimes that intervention could be seeing a provider at CAPS. It could be seeing somebody in the community. It could be a higher level of care, like a partial hospital program, an intensive outpatient program, or hospital. It could be referral to Be Well Health Promotion or to the Student Support Services offices. There's a lot of things that can happen from that. If we believe that a student could benefit from psychotherapy, then we talk with them about what their options are. And we explain what our treatment model is to ensure that whether or not that model is going to meet the expectation that the student has. I know sometimes students will say, I can do the biweekly, but if we feel as though their symptoms are high acuity and they can't really benefit from seeing someone every other week, we have to make the decision to help them get connected to something that will be more beneficial to them. So yes, they do have access to it. I also just want to remind parents, we are building caseloads, which means as students come in, clinicians are building a caseload that they're seeing students and treating them. So at some point, it gets really hard to be able to manage the influx that comes in terms of student interest, which is why we have something like timely care where students don't have to wait. But I don't want to jump into that because that might take me away, and don't want to go down a rabbit hole. But the answer to that is yes, there is no cost to being seen at CAPS, and you do not need a referral for a therapy appointment or a triage appointment at CAPS.
Thank you. And you mentioned all these services and different ways that Brown Health and Wellness interacts with the student. How do clinicians stay on the same page?
I don't know if I fully understand what that means. And I'm not sure if they're asking if clinicians on our team.
I think, well, so the person who asked this did elaborate. They said, so let me go into that. If a student goes to a non-Brown visit for meds or evaluation, so I think they're also talking about like internal resources versus external resources versus, all the different services at Brown.
Great. So if a student is being seen in the health and wellness, and they're getting both their medications and therapy here, Health and Wellness has created a consent to share document that allows us to be able to communicate across documents when appropriate, right? So we don't just share information in a way of just sharing, but if it's a need to know we're really treating someone, we have the opportunity of being able to speak to a health service provider who might be prescribing psychotropic medications for students. The same thing happens in Be Well with Share Advocates. If it's split care, meaning they're seeing someone at Brown, but they have a psychiatrist in the community and actually have a client like that, then we ask for them to sign a release of information form that allows us to be in communication with one another, because as you can imagine, the psychiatric prescriber may not be seeing the student as frequently as the therapist. And so I have the opportunity of being able to support the student and being able to communicate to the provider about what I'm seeing clinically, that then in some ways might help inform the psychiatric prescriber about whether or not there should be a change in medication prescription or dosage, or whether or not there should be a titration up or titration down. So we ask for releases of information because we are in separate institutions.
Great, thank you so much. This next question is for Christopher. And I think we even got a question in the chat that's related to this. It can be challenging to understand all the services and Brown student support structure. Who does a parent call when there's a family crisis and their student needs a check-in, an exam, or an emergency flight home? Where do they begin?
Awesome. Thanks for that question. It's such a great question. Like both Amanda and I said, we are a great first stop for students to come and be able to have that support in navigating all of the resources on campus. First, if we feel like our student is in any immediate danger of either harming themselves or others, we want to make sure that that emergency is being addressed really quickly, right? And so our first point of contact for you, if that's the case, is our Department of Public Safety. We're going to drop a link in the chat to make sure that you have that information and that direct line to be able to call our Department of Public Safety, or DPS as we call them on campus. As far as family crises, well-being check-ins, the Student Support Service Office is that point of contact for students experiencing personal challenges, including family crises. Parents and families are welcome to call Student Support Services during our business hours. We're open Monday through Friday from 8 a.m. to 5 p.m. We'll drop a link for our space as well in the chat. Families could also reach out to our email, studentsupport@brown.edu. If they're looking to consult with a dean, ask questions about what resources are available for their student, how we can get connected back to their student. We're more than happy to do that consult with families at any time. Based on the situations, a student support service dean may reach out to the student directly after information is provided to us, or we may provide guidance to the families with the available resources on campus. One important note for our work: if your student is over the age of 18, we can't disclose details about our past or future interactions without the permission of the student. However, we take all concerns seriously and we make sure we follow up accordingly based on the information that we receive from families. That's during the business day. Brown is set up to make sure that there is support 24/7 around the clock for families and for students. Our after hours support is called the Administrator on Call. It's available during the evenings and weekends. To reach a Administrator on Call, or AOC as we call them on Brown, you can call DPS's non-emergency line and request to be connected with the Administrator on Call. Again, they'll be able to help you navigate what resources might be appropriate at the time, and to be able to connect with your student if we feel like they need to have a check-in based on what they're experiencing at the moment. Some of the other parts of this question are very specific. So thinking about rescheduling an exam. During the semester, students needing to reschedule an exam can seek assistance from both a student support service dean if there's a health-related challenge connected to that, or they can consult our colleagues in the college and they can meet with an academic dean. We'll also throw a link in the chat to be able to get connected to those resources as well. Differently, if the student has an in-person final exam, rescheduling is handled by the college. So students should follow the final exam absence request process if that's the support that they're looking for. Again, we're able to be that first contact and make sure that folks are steered in the right way to make sure that they're connected to that resource. As far as emergency travel assistance, while the Student Support Service Office does not directly provide emergency flights, students can meet with a Student Support Service dean to explore the available options and receive guidance on resources that may assist with urgent travel needs.
Thank you, Christopher. And if a parent wants somebody to go in and check on their student, maybe it's not an emergency, but they just want somebody to do a check-in, what's the best way to go about doing that?
Yeah, I think definitely connecting with us, definitely connecting with the Administrator on Call. We're going to ask some questions about the urgency to see if a urgent wellness check is needed, or if it maybe just be a stop by to check in on them over the weekend. We work really closely with our residential life staff, our residential directors and area coordinators to be able to do some of that work. In addition to that, our Administrator on Call would also do some of those check-ins as well too. So if you feel like there's a need, we're definitely here to talk you through that and be able to enact that service and support if needed.
Thank you. My next question is for Amanda. Amanda, what resources are there for students who recognize that one of their peers might be struggling and need immediate resource from some assistance?
Sure. And one, I just want to say I'm so grateful for this question, right? We're called in to be a community of care for each other. And so I want to recognize that first and foremost. It's a responsibility that we all have to each other and that students have to each other. And our offices play a really large role in making sure that that happens to support students, but also peers who are worried about someone else. If it's an immediate need, if it's an immediate crisis, I'm worried right now, and there might be, again, an imminent health or safety risk. Christopher shared, right, the Department of Public Safety, the administrator on call, they can enact EMS to get the student resources right away, right? But perhaps what's embedded in that question is, I'm worried, I've noticed some things, I'm worried about my friend, and it's not an immediate need. I understand I can call DPS and get EMS to their residence hall, but I'm not sure what to do now, or even how to talk to my friend about maybe I'm worried for them. I think there's a couple things that I would highlight here. Lots of students come into our office within student support services and say, I don't know how to talk to my friend. I'm worried about them. And I'm worried about them in the following ways. And we ask questions, right? One, so we can get a little bit more information and determine, right, the immediacy of the concern, but also, and I will highlight very specifically here, so that we can talk to your student about getting support for them. Because the management of being worried about a friend or being concerned or noticing patterns of behavioral concerns that are worrisome or that might be signs and signals of distress can be quite a bit for a student to have to navigate and take on as a friend or as a peer. So I would have students come in and talk with us. If it's not an emergent in crisis need, they can also go to counseling and psychological services. That's absolutely a place. Sometimes students say, I see my therapist and I'm going to talk to them about what should I do about my friend that I'm concerned about in the following ways. So both offices, SSS and CAPS. But the other thing is, what I'll say is students should go to a trusted resource, a trusted older adult on campus. That can be a faculty member too, right? Whomever students feel most comfortable going to, that could be an area coordinator, our professional staff that live in residence. There's lots of different folks who are absolutely willing to engage in conversation, right? And can direct students to resources, including those that are here represented on this call. So yes, you can go to student support services, you can go to CAPS, you can go to BeWell, right? And that might feel confusing for students. But what I will say is, if you have a trusted coach, faculty member, whoever that might be, start there, right? If you already have that pre-existing relationship, or if the identities based on what you hold true and important to you are reflected in that relationship with that faculty member or coach, and it's important to speak to someone who has shared identities first and foremost, do that. Those folks will get tracked into our office. We are communicating with people across campus on a regular basis. They know to share concerns with us. So that's really broadly what I would say, but very often students start with our office and then we work with them to figure out whether or not there's an urgent immediate need. And we also work with the student to say, how do we make sure that we're taking care of you and that we're figuring out the support and resources that you can and should engage with? Because sometimes it can be, as I said, quite a bit to navigate being worried about a friend and a full course load and everything else that our Brown students have to do.
Thank you, Amanda. Bryant, I have a few more for you. We've had a few questions about wait times. So when a student does come to CAPS, what's the typical wait time? And if somebody is struggling to get in and a condition is intensifying, how do they manage that?
That's a great question. So CAPS, I would say the scheduling of CAPS sort of flexes over the course of a semester. And what I mean by that is, at the beginning of the semester, it takes, I would say, about maybe 2 to 3 days, maybe 4, for a student to be able to get in for a first appointment. I'm not going to lie, usually around, I would say, maybe the third week from week 3 to 6, we often get this surge where the appointments do go out beyond 5 days. I do want to be clear, they don't have to go out that far, but they do go out that far, and partly because students have asked to be able to be seen for a triage appointment at CAPS. The reason I say it doesn't have to is because we do have this lever, which is called timely care, that students can access and really get in sooner. I think one of the things that some feedback we've gotten is that we view timely care as an extension of the services that CAPS provides. So we see them as being colleagues. I think for Brown students, there may be this uncertainty, or maybe there's some curiosity about the actual service and what it means. And so they will say things like, well, I prefer to have an in-person triage appointment at CAPS. And so when they choose that, then that does cause the appointment to be scheduled out sometime. We always remind a student every time they call that if they don't want to wait, that they can actually schedule something with timely care. And we always remind students of urgent care services whenever they're calling for a first appointment. And then right now, I would say about maybe since 3 or 4 weeks ago up until now, I think it's almost like a bell curve, a bell-shaped curve, if you will. We're now coming on the other side where I would say about maybe 3 weeks ago, we get people in the next day or sometimes the day of, depending on when they call. So it does flex over the course of the semester, and a lot of that depends on the needs and the caseload building of the clinicians. We also have to respect the fact that, if students are wanting to be seen in person, they're going to elect to be able to wait. And so we remind them that if they don't want to wait, we don't want to serve as gatekeepers to prevent them from being able to access services. So even if it's not timely care, if they want to get connected to a community resource, we can help them do that as well. I know another question I think that I heard in there was the frequency of meeting. And I know that we have a model that is biweekly, and I know that sometimes people require weekly psychotherapy. And I think we will have conversations with students about maybe finding a higher level of care if they're finding that biweekly psychotherapy is not meeting their needs or their expectations.
Thank you. And we did have a question in the chat that came through about medical release forms. Can you touch on that a bit?
Yeah, thank you, because I actually responded to the parents saying I would do that live. There's been lots of questions related to release of information forms and whether or not they can get their student to sign it ahead of time. I will be honest with you, we often encourage students to sign release of information forms once they're in our office. The reason we ask to do this is for better or for worse, your student is an adult and they have agency over what is communicated to people regarding their health care. And so if there are things that they do not want us to communicate, then we have to respect that. We always let students know that our confidentiality is to them and not to their parents. And so signing a release of information form before they even had a meeting with someone, to me feels a little ill-advised because we don't want students to be without that level of agency. We always inform students when they are signing the release of information form, just because you signed this form doesn't mean that we communicate or talk to parents without the consent of the student. So anytime someone may reach out to us asking some questions, we're going to go back to the student to say, hey, we got this call from your parent or your family member. They're asking about this. Is this okay? And if students say it's fine, then we're happy to do that. But if they don't, then we're not going to communicate. And on that note, this is another thing that I want to just put this out there because I get so many parents who get angry with me, and it's okay. But they'll say, I called you yesterday and you spoke with me, and now I'm calling today and you can't talk to me. Why not? And I just want to say ahead of time, releases of information forms can be active and inactive, and they change on a dime. Your student can come into my office. They can say, I want you to speak to my parent today. And then they come in tomorrow and say, I want to rescind that release. That means I'm no longer authorized to be able to communicate with you. It's not because I'm being difficult or that I'm avoiding you. It's just that I'm respecting my client, or I'm respecting the student who has now rescinded that release of information form. So that's why if you find that our communication sometimes is inconsistent, it may be because the release of information is no longer active.
Thank you. I want to make sure that I get have time for non-clinical approaches. So I'm going to shift a little bit there because sometimes there's the expectation that therapy is the only option, but really there's a lot more, as I think everyone's mentioned, that can be supportive and can be proactive. So I'm going to start with Tanya. We all know stress is normal and a part of daily life. So what is Brown doing proactively to support students who have anxiety and distress? I mean, this is stressful time for students because of midterms and all the normal college stuff, but we know the world is a stressful place.
Thank you, Mikkel, and thank you for that question. There was also a couple questions in the Q&A that were geared towards this a little bit, so I hope that I can do your questions justice. So like Mikkel said, stress is a very normal part of life, and there are very unique stressors to being in college. Also, everybody has different ways that they can effectively manage stress. So what works for me might not be the same thing that works for Bryant, Mikkel, Amanda, or Christopher. I think if we all took a minute right now and said, like, what's your #1 stress reduction strategy, each would be different from the other one. With that being said, while students are here at Brown, we want to be able to introduce them to a really wide variety of skills, techniques, and opportunities so that they can really build that toolkit. They can learn about when each of those unique stressors comes their way. What is the tool, the technique, or support that I might need? And they're building that up because those are the skills and tools that they're going to take with them after Brown. Those are things that they are learning now so that they can carry that with them, hopefully throughout a lifetime, and teach them to other people. So we do have a variety of tools that are online, and that one just went in the chat. So there's resources for stress reduction and coping strategies. That is a whole bank of online tools, everything from recordings on how to do breathing exercise, for strategies to coping with unique worries, to mapping out who your social supports are, so that you might know a specific type of stress. I know that's the one I want to call my parents for, right? I have this other stress, and that's the one where my best friend from high school is the best to help me. And then I have another unique stress related to college, and that's the one I know that there's a faculty member or an academic dean that is going to be able to support me with that. So really unique, thoughtful tools, again, that are evidence informed, that can help our students really figure out the strategies, the resources that might work for them. Besides those online tools, which are more of an individual tool, there are so many groups and workshops throughout all of Brown, and specifically in health and wellness, that really focus on coping with stress, anxiety, or worry. CAPS offers at least twice a semester, I want to say, every semester, an anxiety toolbox. A link will come up to that shortly. BeWell has weekly restorative yoga groups. Our student accessibility services offer groups. There are so many of those resources. There are a real vast array of them because we want students to be able to try different things and pick the one that might work best for them. We also are lucky to have a really rich mindfulness center at Brown. That is a place where students can specifically learn about mindfulness practices. Some of mindfulness is truly meditation and learning how to practice meditation. Some strategies for mindfulness are things that people can learn and take with them in their daily life. There are ways of sort of managing your thinking or the way that you operate so that you can move through life with a little bit more ease and a little bit less stress. I also really want to make sure that I also mention that a big part of what my department does is go out and train student leaders all across the campus who are already embedded in the community. A lot of these stress reduction, coping, and referral strategies. So what that means is that our reach and our ability for students to learn about this broadens by the thousand. We are training Meiklejohn peer educators, who every first year is assigned one of them. We are training our community coordinators in Res Life. We're training groups of student athletes who are leaders in the athletics community. We are training all these students so that they have the skills that they need to really help their peers who they're already connecting with daily, regularly, where they're living in the classroom, and can teach those skills and can do them in real time with other students when they need them. So it might be a specific breathing exercise that is like the right one that works right before you're about to take that exam, right? You start to notice the signs of stress, your heart rate elevating, or your thoughts spiraling. What's the technique for you to use in that moment, right? So that it doesn't get worse, you can re-regulate, right? And you can perform on your exam in the ways that you intended to. We also have wellness peer educators at Be Well that offer all sorts of interventions that meet the community where they're at and offer stress reduction tools. We work very regularly with different centers on campus, and I'm just going to highlight Global Brown really quick because of one of the questions that came in. And our Global Brown Center really focuses on our international student community. And we will work with them so that we can create interventions for stress reduction or coping strategies that meet the unique needs of the international community, right? So we are listening, we want to know what is coming up, and then we are making sure that we provide the tools, strategies, interventions, or sometimes just the information that somebody needs, right? So that they can kind of settle their thinking. There are just countless examples of the ways that there are opportunities. There are so many both active and passive opportunities for students to engage in stress reduction. There's no right way to do it. A student can engage in the ways that are most comfortable for them. And then continue to try things until they sort of have built that toolbox up of the strategies that are right for them. So please, at any time, know that the resources, the opportunities are there, and there's no right one. There are so many that can be tried and that I know that our students find effective and get better and better at each year that they're at Brown as their stresses change and as their abilities to cope shift and hopefully increase.
Thank you, Tanya. It's an impressive list. And if anybody's missed any of those links, you can always reach out to me and I can point you in the right direction. I also want to put in a plug for a webinar we did in January that was with our colleagues in the college that talked about academic stress specifically. So if you go to the webinar page of the Parent and Family website, you can watch that video, and that is talking specifically about academic pressure. This next question I have for Dr. Ford. This was one that came through in the registration, and it was about how the university manages and supports students after the passing of a Brown community member. Can you talk a little bit about that?
Yeah, so I also want to invite my colleagues in Student Support Services to join in on this answer. So I'm going to speak broadly because this is not something that hasn't happened, or this wasn't the first time it's happened at Brown, and happens across the country. I think whenever we experience a loss of a member of our family, there's a number of things I think we do, in particular with CAPS in concert with other offices. We offer resources to students to let them know that we're available. We often will also communicate to students directly, the ones who are directly impacted by the event, and find ways in which we can either create space for them and or their peers. We also work in concert with our chaplaincy office because they offer a bereavement group, and so there's opportunity for students to participate in that. And then I think there's often a gathering that we create that allows students, I'm sorry, not just students, any member of our community who has been impacted by this and wants to be in community with others to be able to remember. We also work with them and create that space But I want to turn over to Student Support Services and see if they have anything they'd like to add.
Thanks, Bryant. I think that was a very helpful overview and capture. I think one thing that I would highlight is we know that grief isn't linear. And so if we have a sense of who the students are who are feeling most impacted, that's typically managed, as Bryant said, through CAPS and Student Support Services. Student Support Services makes direct outreach to those students. We will always miss a student because it's usually self-reported. We call together who was in a student's class, who lived close to the student, maybe where they were involved in a club, an organization, a sport. But there will always be a moment that we won't catch everyone. And typically in the outreach that we do to the students who we know who have been most directly impacted, we typically say, if there's someone else that you know of that may be struggling with this loss, if you feel comfortable, please remind them that these offices are available. Or if you feel comfortable, share the name with us, right? So that we can make outreach. Students are not mandated to meet with any of our offices. Sometimes students get an email and say, I can't talk about this right now. Thank you so much. And then we follow up, right? To my original point of as folks on this call know, as older adults, this process of grief and loss is never linear. And so we then see several weeks later in the semester, we send another round, right, of outreach. And it's never, a science, it's an art, right? But we pay attention, right? In our residence halls, we pay attention to what's happening on a sports team and the ways in which we as a community not only share information, but hold the responsibility of supporting students, again, who may be managing the loss of a peer. And so that is work that unfortunately is not something that we don't have experience in. But if there's something that we might be missing, we always ask our community students, but also parents, right? We have heard from parents to say, I don't know that my student got any outreach, or I don't know that anyone's talked to them. So please let us know if that's the case. You can certainly write into us too.
Amanda, can I stay with you for just 1 second for a question that came in about student leaves? So what are the limitations to a student leave and what's Brown's approach to student leaves?
Yeah, so I'm going to speak very broadly in the interest of time and point folks to 2 different websites. Our website, Student Support Services, as it relates to taking a medical leave, but also the college's website for taking a leave and personal leave. So there's 2 different options here. A medical leave, again, is for a mental health or a physical health concern. A personal leave can be any number of reasons why students might want to take a personal leave of absence. What I'll say broadly speaking is that for medical leaves, the clearance process, meaning when a student is ready to come back and what's associated with that, that's done by committee. We may process medical leave of absence, but there are several different folks across the community that make these decisions to make sure the students feel ready and are able to come back based on what the treatment provider has shared, not Brown's opinion of whether or not a student is ready to come back. We're looking at documentation on a committee basis to make sure that folks feel ready based on the treatment that they've engaged with. And we trust that provider recommendation to make sure that they're ready to engage back in classes. Personal leaves, I would again point folks to the website that the college operates. But really what I will highlight here is students on any kind of leave for more than 3 years have to petition the Committee on Academic Standing, right? Because you've been away from classes and the rigor of Brown, assumably, maybe you're taking classes elsewhere. But anything that is more than 3 years, they have to petition the Committee on Academic Standing, which is operated by the college. We're getting a little granular here, but I hope that that helps folks as it relates to the Committee on Academic Standing will work with the student, and this is academic based, right, to make sure that they have what they need and understand how to re-enter. So that may be course selection, that may be mapping their trajectory academically speaking. So the approach is one both made by committee, by both personal leaves and medical leaves, but also is one that we trust the recommendations, particularly from treatment providers, and then welcome students back. Our office works with them to help support them through the return process. I hope that broadly answered the question. If there's something specific, please feel free to follow up or refer to our website.
Thank you. And I have both the college and Campus Life links in there. So please take a look at that if you need it. Dr. Ford, we had a number of questions come in about referrals. Can you talk broadly about referrals?
Parents often ask us if there's a sort of like a Rolodex or if there's a spreadsheet that we have of community providers, if they're looking to get their student connected to community resources. And I think what's important for you to know is we often use two platforms. We use ZenCare and we use Psychology Today. We personally do not keep a Rolodex or a spreadsheet of providers for two particular reasons. One, it's hard for us to know availability. And we've often had students where we have given them names of providers, and then they call us back in frustration by saying none of these people are taking on new patients. And then the second thing that's really hard for us is we also sometimes don't know what insurance they have. Sometimes we know, but sometimes we don't. And many providers in the area don't accept insurance. And so it gets really challenging when a student wants to use their insurance to get care, but providers may not. And so the nice thing about ZenCare and Psychology Today is there's a filter system, and it allows you to be able to go in, and it allows you to be able to put in the things that are of particular interest for you and or your student. So if you want in-person psychotherapy, you want to use your insurance, you have a particular interest in the gender or sex of the person, you also may want to work with someone in a particular skill set, whether or not they do CBT or DBT or might be dynamic in their therapy. You can put all those filters in, and then it will give you a list of people. The nice thing about ZenCare is they actually vet their providers, and they actually have a sense of who has openings that are fairly accurate. So when you go into ZenCare and you create an account, once you go in and you find someone that you want to see, then they list when they have sometimes 15-minute sessions where they will check in with you to see if this is going to be a good fit. Because we all know that therapy is really about relationships and whether or not you connect with the person. And if that happens, then you get to work with that person for however long you would like to work with them. But that's a big reason why we don't have names that we give out, because we just don't want to give you information that's false, and it leads to further frustrations in terms of trying to find someone. I truly believe that ZenCare and Psychology Today will be accurate and up-to-date resources for you to find providers in the community. The other thing that I would also just want to say very quickly, and that is when you are responding to a community provider, if you have no history of being able to do that, because it could be a bit daunting, just know they may not respond within 24 hours. They typically may take a little bit longer to respond, and so don't be disappointed if you don't hear something quickly. I think if it's about maybe 3 or 4 days you haven't heard from someone, that might be an indication that they could be full, and they should let you know regardless, but give yourself at least 24 hours or a little bit over before you hear from someone about their availability. Oh, one more, sorry. And ZenCare was created by a Brown alum. I just want to put that out there. And so they fully understand the complexities of trying to get connected to a community provider, and they want to be able to make it more seamless. And I promise, Mikhail, that was my last comment.
No, that's important. I didn't know that. That's exciting to know. Okay, one last quick one, and then I think we're going to have to wrap up. We did get a few questions about balancing athletics as well. And I think, Christopher, you have some information on the resources available specifically for athletes.
Sure, absolutely. Again, we can be a point of contact to kind of get students and families pointed in the right direction. Our office works directly with the team in athletics. We collaborate and work closely with them. We have a weekly athletic care team meeting to ensure that student athletes receive the support that they need in a very holistic way. The Student Athlete Development Office is an office that provides academic support tailored to athletes. This is such an amazing resource specifically for our athletes, and we are in close collaboration to get them connected with that resource as needed. In that care team, we also talk through mental health resources and making sure those students are connected to the right resources as well. So student support services can absolutely be a first start in getting connected back to those resources.
Thank you so much. And with our final moments, I'm just going to give each of you a second to wrap up. Let me start with you, Christopher, since you were last on screen.
Yeah. Thank you all. It was great being able to provide some of this information. Please, if you have a question, please feel free to reach out to us for us to be able to answer. We're really here to support you and your students in making sure that they have the most successful opportunities to be at Brown.
I would echo Christopher's sentiments, and parents and guardians and again family members are partners in this work with us. We need all of you, and you don't have to keep track of all the acronyms and the differences and the similarities between our offices. Although there's so many good resources here on campus that we would love it if you had more of that awareness as you track towards which one makes sense for my student right now through this webinar. We need your help in this. So if you're worried about your child or your student, please feel free to call us. You can pick up the phone and consult with Student Support Services. That is not uncommon. And in the work that we do with students, we often say, can we bring family into this conversation, right? So that you don't feel alone, as long as that's a relationship that feels supportive and safe for you. And so please don't hesitate to reach out to us if you're worried, but also know that sometimes we're having that conversation back with your student to say, how can we let family know? How can they be partners with us to make sure that you get the support that you need? It is not singularly on your responsibility to do this alone. Let's bring in, a grandma or an aunt or parents so that we can do this together. And I hope that that is an invitation for all of you on this call to make sure that you're talking with your student about, hey, have you met with any of these resources? But also, if I'm worried, I'm going to call. I'm going to get you the help that you need because you're here at Brown for many reasons, but to be successful, and hiccups and obstacles happen. That's normal. Let's get you through this together.
I would just really reiterate what was already said. We are allies and partners in this with you. The only thing that I would add that would really be, again, in addition to what was already said, is that if you are hearing from your students that maybe they have tried a service or maybe they can't find the thing that's working for them, please talk to them about being persistent and trying again. If they met with one therapist at CAPS and it didn't work, there are so many other therapists with such diverse experiences and identities that they can meet with. Maybe they tried one BUL workshop and said it wasn't for me. Go to another one. There are so many. It is so diverse. There are countless opportunities. So persistence, I think, with the resources that are available, and we really will meet them where they're at. All of our areas try and do our best to find a match. So thank you.
Great. I would echo with everything that my colleagues said. I guess I would end with, if you hear something from your student that sounds curious, just give me a call. It's not uncommon, I think, for students to hear something and relay it to you, but there may have sometimes be a miscommunication in terms of what was said. Now, they may be spot on, but if something just feels really curious to you, just know you can always call me and I'm happy to have a conversation with you.
Thanks so much, and thank you to everyone who joined us today. Please enjoy the rest of your day wherever you are in the world. Thank you for attending, and please fill out our survey if you do have a moment or two. Take care, everyone.